Good afternoon. So today we have a few important updates on schools, childcare, and the launch of the state's Pandemic Unemployment Assistance Program, and we'll also provide a quick update on testing and hospitalizations related to COVID-19. Before I get into that, I want to address what I think is on everybody's mind, which is when does new normal get here? Right now, the Commonwealth is still in the surge, and while we're seeing fewer positive cases per day, more and more COVID-19 patients are being admitted to our hospitals. Our healthcare system is keeping up, thanks in large part to a ton of planning and your efforts to stay home, socially distance, cover your face in public, and work remotely. But the data shows we're still very much in the grips of a pandemic here in Massachusetts. Now, I know that's hard to hear and it's hard for me to say, but there are many unknowns about COVID-19, and our healthcare experts and epidemiologists are learning more every day. But what we do know is that there's no cure, there's no vaccine, and that COVID-19 is an insidious and at times invisible virus. The facts on the ground tell us that we need to stay strong, continue to socially distance, and stay home. While we ask for your full cooperation to get this job done, please know that we're working hard to think about a strategy to reopen the economy. We'll have much more to say about this in the days ahead as we pull together the best and brightest minds from our business and public health and academic communities to work together to put together a thoughtful framework that can work in Massachusetts. I think we all want to move on from this, believe me. But I think it's really important for people to understand what's at stake. I can't wait to see my 91-year-old dad again, but I don't want to see him unless the circumstances and the situations and the rules of engagement are right, and that the data, the prerequisites about what's actually going on the ground here in Massachusetts support that kind of thing. Doing it wrong could create more hardship for everyone in the long run, and we're going to do everything we can to avoid that. So right now, people need to dig deep and stay put. Please only go out when you need to, and wear a mask or cover your face in public, especially if you're in a position where you won't be able to physically distance. We are all in this together, Massachusetts, and we will come out the other side of it stronger than ever. With respect to testing, yesterday the Commonwealth conducted 7,157 new tests. That brings us to a total of around 169,000 tests. The state reported 1,566 new cases of COVID-19. The last few days we have seen fewer positive cases day to day, but it's too soon to draw a conclusion from that data. First, a few days does not represent a trend. We've said that many times. And we have seen the data bounce around over the course of more than a few days. Second, the number of positive tests is entirely dependent on who gets tested. And what I mean by that is the daily test totals don't represent necessarily what's happening across the entire Commonwealth. For example, we've prioritized testing for nursing homes and hotspots, which obviously affects the number of positive tests we get when we test. One piece of data that we watch very closely is the number of hospitalizations for COVID-19, and we are still seeing an increase here. On personal protective equipment, we were pleased to receive 400 ventilators from New York on loan. We reached out to Governor Cuomo's office in New York last week. They're on the other side of the surge, and they were kind enough to lend Massachusetts this life-saving equipment during our surge, and for that, we are enormously grateful. As of yesterday, we've delivered over 5 million pieces of personal protective equipment, and our command center is communicating daily with hospitals and medical professionals around the Commonwealth to monitor the capacity of our hospitals. As of the end of the day yesterday, there were approximately 18,100 available beds statewide. Approximately 3,800 beds are occupied for patients with COVID-19. About 10,300 beds, or about 53% of our beds, 58% of our beds overall, remain unoccupied and available for patients. Those empty beds include about 6,800 acute care and non-ICU beds, approximately 2,600 ICU beds, and 900 beds at our field medical hospitals, although we do anticipate that hospitalization rates may increase in the coming days. As I've said before, this is an insidious virus, and it puts our doctors, our nurses, and our other frontline medical staff to the test. But thankfully, we have some of the greatest healthcare providers in the world here, and we have all worked enormously hard to prepare for this. Many hospitals have reported a reduction in patients seeking care for other serious medical conditions, like heart problems and cancer treatments and kidney dialysis. It's important to remind the public that our hospitals have made accommodations for COVID-19 to ensure that they can also care for other healthcare problems. People should still call their doctor to talk about their own health and their own health care and go to the hospital if they have an emergency. We worked hard to set up a telehealth program for people so that they could more easily connect with their healthcare provider, and many people are doing that. And Buoy.com, which is a Massachusetts-based company that gives people the opportunity to diagnose online using their artificial intelligence tools, have actually served at this point over 90,000 people. And there have been people in cases where they've worked through the system where their recommendation has been to call 911 and to go get the health care that they need. Please, use the system. We worked really hard to make sure that it would be there for you if you had an issue or a problem that had nothing to do with COVID-19. If you don't feel well, please contact your clinicians, engage, and be involved in making sure that your health care needs are taken care of. Call 911 in an emergency and get to a hospital if you need immediate medical help. We don't want people getting sicker or exacerbating an illness or an injury because they have concerns about the healthcare system's ability to meet their needs. Folks are there. Folks want to serve. That's what all this preparation was all about. Today, with respect to schools, today our administration is announcing that all public and private schools will remain closed through the end of the school year. Remote learning will continue in all districts. This does not apply to residential special education schools. This is a big decision, and the Lieutenant Governor and I have spent tons of time talking with Secretary Jim Pizer, Commissioner Jeff Riley, and many of our leaders in local communities about this decision across the Commonwealth. It's the right thing to do considering the facts on the ground associated with the COVID-19 pandemic. And at this point in time, there is no authoritative guidance or advisories with respect to how to operate schools safely and how to get kids to and from schools safely. We believe students, therefore, cannot safely return to school and avoid the risk of transmitting this virus to others. As we've said before, closing the actual school buildings for the year does not mean it's time to start summer vacation early. We're making this decision to allow school districts to plan through the end of the year to offer remote learning for all students. This includes students with special needs and English language learners. Massachusetts is home to some of the brightest students in the nation, and this pandemic has upended their lives as well. Being away from their friends, their teachers, their sports, and other important resources, for many of them, all of them, has been a terrible loss. School administrators, principals, and teachers have worked hard to create curriculums and materials and to help their students keep learning at home under these very difficult circumstances. We appreciate how challenging it is to be apart from your students and still find ways to keep them motivated and committed to their studies. The Department of Elementary and Secondary Education is taking additional steps to boost remote learning efforts for the remainder of this school year. The department will start preparing for summer learning, especially for students at risk of falling behind grade level, to ensure a strong start for all students in the fall. In the immediate future, the department will launch a remote learning initiative that will provide more tools for teachers and students to utilize from home. The department will also launch an advisory group comprised of school officials, students, parents, and business leaders to work on creating more resources for schools. Commissioner Riley will expand more on the details of this shortly. School closures also put a tremendous strain on parents and guardians at home. Remote learning means parents have to juggle their own job, whether it's working from home or still making their shifts while helping their kids stay focused on school. We know it's not ideal, and we recognize that we're asking a lot from parents to hang in there for the remainder of the school year. The end of the school year typically represents an exciting time for all students. Championship games, field trips, outdoor activities, and other great events that sometimes happen once in a lifetime are supposed to fill the calendar. And that's especially true for high school seniors. They've all worked hard for 4 years, and they look forward to the so-called last season, whether it's to play lacrosse, run track, participate in a school play, go to the prom, graduate. Because of COVID-19, a lot of this will not happen, and some of it will happen in ways that are far different than anybody would have imagined it just a few months ago. And as the father of 3 grown children, it stings for me too, because I remember how precious this time is. So to all the seniors, we would just say you should keep your heads up. The end of the year may not proceed as planned, but there will be, because there always are, brighter days ahead. We'll get through this pandemic together, and thanks to the creativity and spirit of your parents, coaches, school administrators, and teachers, we will do all we can to do what's best for kids across Massachusetts. We're also extending the previous executive order closing all non-emergency childcare programs until June 29, 2020 as well. Emergency childcare programs will continue operating as they have been. These programs will keep serving healthcare workers, first responders, and other essential personnel who must continue to work, including grocery store workers. There are currently 523 programs statewide serving families of essential workers who are serving an average of 2,500 children per week. And we're grateful that so many providers stepped up to participate in this program. The department will continue to pay subsidies to child care providers based on their pre-COVID-19 enrollment in order to support their workforce. Again, we know that the lack of child care for many families has created an unanticipated burden, and it's hard to look after young children and balance the demands of working at home under the same roof. But maintaining this structure is the best way to keep our kids and our providers safe from the spread of this insidious disease. In the coming months, we'll be working towards slowly restoring child care capacity for both family child care and center-based programs once it can be done safely. In the meantime, EEC is developing a partnership with Care.com to help unemployed child care workers provide in-home care for essential workers and to support families with children who have special needs. The department's also launching a partnership with WGBH to build on efforts to provide resources and activities for parents that they can do with their young children. I want to thank the team and especially all those early educators up during these extremely difficult times. They're making it possible for our frontline workers to get to work, keep us healthy and safe. As some of you may know, yesterday we launched a new unemployment application form for workers who are not typically covered by unemployment insurance under the traditional benefit program, self-employed and so-called gig economy workers. The new benefit program, called the Pandemic Unemployment Assistance Program, was created under the Federal CARES Act. It creates an unemployment benefit for people out of work due to COVID-19 who do not qualify for traditional unemployment insurance because they don't have a traditional employer relationship set up. Claimants who qualify will receive weekly benefits that include the additional $600 that all claimants are now receiving, which is the result of another CARES Act benefit. We're glad that we were able to quickly build up and launch this new platform to accommodate this benefit about 2 weeks ahead of schedule. Massachusetts is one of the first states in the country to implement this benefit. Thanks to a lot of hard work from Secretary Rosa Costa and her team at Unemployment Assistance, the new application form is working well and was able to process a major influx of about 50,000 claims in the first day. Residents can go online at mass.gov/PUA and apply if you do not qualify for traditional UI. unemployment insurance. We're also working to help people navigate the state's traditional unemployment system. We have an 850-person remote call center connecting with applicants every day to help them through the process, and have held daily town halls in English and Spanish that have been attended by over 175,000 constituents. We know this virus has caused serious economic disruption and anxiety for people, and we're working as hard as we can to get people the benefits that they need. You know, yesterday here in Massachusetts was Patriots Day. And for lots of people who have appreciated what Patriots Day has meant over the years, it was obviously not the same. No marathon to cheer on, no Red Sox game to watch while you should have been working. These aren't small things to miss out on for people in Massachusetts. Like everybody else, I was missing these things yesterday as well, but I also got an email that helped me work through that. I'm going to keep some of the details vague so it remains anonymous, but I want to share a little bit of what it said with everybody. The email was from a woman who's going through a lot. She has a spouse with stage 4 cancer and an adult child living at home who works in the public sector, who's out there every day doing their job. So not only is she worried about getting the virus herself, she has some special people in her life who really are at risk. She wrote to tell me about the support she's gotten from her neighbors. Small acts of kindness, like dropping off protective gear for her husband so he can wear that when he goes out to get his cancer treatments. Strangers are giving her child their masks, just in case her child didn't have access to those at work. And in the middle of all this, she wrote to me just to let me know that they're doing okay and they're getting by. I know we were asking a lot of people when we put the stay-at-home advisory in place in the first place. And I know we were asking a lot from people when we ordered certain businesses closed temporarily. And I know that we all miss sports, gatherings, meetings, friends, all the stuff that has always been a presumed part of our daily lives. But we all need to remember why we're doing all of this. We're doing it so women like that woman who emailed me on Patriots Day can still get her husband into the hospital for cancer treatment and do so safely. And we're doing it so public servants like that woman's child can do their job serving the community as best they can under the current circumstances as safely as possible. I know yesterday was a hard day for many, but it's a lot harder for many of our neighbors, those who are caring for the sick, are out there every day serving the public. On behalf of them and so many others who are stepping up day after day in the midst of this pandemic, let's all just keep up the fight against the virus, and I want to thank you again for all that you're doing.